So the question back to using a chatbot
Uh-huh. Mm-hmm.
and
Mm-hmm.
using machine learning and artificial
Mm-hmm.
intelligence. Um, I think the efficacy, to your point, I think that's still um, a big question for
Mm-hmm. Mm-hmm.
tech-related mental wellness.
Mm-hmm.
But how accurate do you think,
Mm-hmm.
um, not accurate is probably not the right word, but how effective do you think
Mm-hmm.
um, tech-enabled mental wellness coach um, may have on a
Yeah.
population? Yeah.
Yeah. So I was kind of scrolling through the Wobot website and looking at, who they are and how they describe their service and their mission. And I really liked how the clear parameters with which they framed
Mm-hmm.
the service, because I do
Mm-hmm.
think the question is not so much whether or not tech can be of service. It's the
Mm-hmm.
question would be how. And one of the things that I noticed is that the owners of the company um, very much put it out there that they don't mean for a robot to be a replacement of
Mm-hmm.
of human beings. Essentially, they don't mean for it to be a
Sure.
replacement of therapy, but more of an additional resource, more of a supplement
Mm-hmm.
that very much hones in on a specific way of intervening with certain symptoms.
Mm-hmm.
Using CBT techniques, so cognitive behavioral techniques,
Mm-hmm.
specifically, I think they're using interventions with distorted thinking.
Mm-hmm.
So all or nothing thinking, or sometimes we call it catastrophic thinking, but
Mm-hmm.
basically helping to intervene with how people's thoughts may maintain feelings of anxiety, feelings of depression. So they were very clear about the fact that it doesn't necessarily replace therapy per se, but
Mm-hmm.
may
Mm-hmm.
be very, very helpful in terms of an additional resource and to
Mm-hmm.
supplement that intervenes with certain symptoms, essentially.
Mm-hmm.
Yeah,
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 no, I think that's a good way to think about that as a supplement,
hmm,
um, as a secondary resource.
absolutely,
Really,
yeah, yeah,
yeah,
hmm,
I just think
hmm,
there's still so much to
yeah,
be done in on
hmm,
this topic,
absolutely,
and I do think that technology will play a role, but they
hmm,
do have obstacles and barriers that they'll have to overcome, especially when it comes
hmm,
to efficacy and regulatory oversight. And
absolutely, yeah,
do these products have to be FDA approved because they're,
hmm,
if they are claiming
hmm,
um, to be, clinically effective? I
hmm,
think
hmm,
that's something that we'll probably hear more on that um,
certainly.
in the future.